Hello, and welcome to another edition of Calm in the Chair, the Dental Fear Solution. I am your host, Dr. Vincent Monticciolo. Today, we're going to be discussing probably the most important reason for treatment under sedation. That is the medical and systemic issues caused by poor dental health. Obviously, we have the dental issues that we treat. However, these actually have a larger importance when it comes to our overall health. The mouth or oral cavity is a direct pathway to our organ systems. We swallow over 1,000 times a day, and all that bacteria, infection, and literally bugs are going through our system. The mouth is the dirtiest orifice of the body, and we are continually swallowing and passing all this bacteria through our bloodstream. Today, we are not going to go deep into the science or organisms that are doing this damage, but I do want to touch on the major issues that I see daily and the major organ systems that are affected. In the podcast notes, I will have the following two handouts attached, one which depicts the organ systems that are affected, and number two, the 10 most common medical conditions caused by poor dental health. If you're in the office or any of our dental offices, you can get a free copy of Your Guide to IV Dental Sedation. And in here, I also have a chapter on all the oral problems that cause medical conditions that are affecting our patients. Very important. I see it daily, and that's usually what gets the patients actually to finally come in. So we're going to start with some of the systemic health conditions of poor oral care, starting with number one, the heart and strokes. Research has shown that there's a direct correlation between periodontal disease and higher risk of heart attack, stroke, and atherosclerosis due to the chronic inflammation and bacteria that is spreading daily through the bloodstream. So most of our patients that have neglected or due to fear or phobics or gaggers or special needs that don't come in, the majority do have periodontal disease that is causing this daily infection of their system with all this inflammation, all this bacteria. So we'll go a little deeper into that further in the podcast. And number two is diabetes. So we know periodontal disease worsens insulin resistance, leading to more poorly controlled diabetes. Conversely, unfortunately, uncontrolled diabetes accelerates the gum destruction. So it's kind of a double-edged sword. The periodontal disease is causing a problem with the diabetes, and then the diabetes is causing more destruction of the gum disease, causing more loss of teeth. And obviously, diabetics heal more poorly. So we do see a lot of issues and loss of teeth and breakdown of the restorations and the mouth. So we want to get it under control. One of the other issues that we see on a daily basis that's more of a sad situation is the respiratory infections. Obviously, aspiration of oral bacteria, plaque, food debris can lead to pneumonia, particularly in the elderly or cognitively impaired patients, some of our Alzheimer's and dementia patients. I see this daily coming from some of our nursing homes and assisted living facilities and patients that are unable to do a proper daily cleaning of their mouth. These patients catch pneumonia from all this bacteria that's forming in their mouth that they're swallowing daily. They're unable to fight it off, and lots of times they pass away in a facility. They blame it on the pneumonia, but actually it started from all the bacteria and infection that they've been swallowing daily. That was the actual reason of that pneumonia. So that's one of the first things we try to do when we get these patients in is clean up the oral cavity, try to get it much healthier, get all the bacteria out, and try to restore some health and function in these patients. The other risk, some of our risks are pregnancy risks. So everybody knows, we see more breakdown in pregnant patients, but poor oral health is also associated with preterm births and low birth weight in infants. So you don't want to be swallowing all that infection, all that bacteria when you have another life on board. So, and then obviously we see daily the tooth loss, bad breath, difficulty chewing that occurs as your oral cavity breaks down, which gives patients loss of self-esteem and in some cases, even depression. So we're going to see what that impact is on some of the sedation patients that I see on a daily basis. And we're going to start with the avoidance patients, which is one of the bigger class of patients I see, which would be the dental phobics and the needle phobics. So due to fear, obviously they stay out of dental offices until they either have pain that drives them to the office, or their teeth are getting loose and they're worried about losing a front tooth, or they become so infected and urgent care wasn't able to help them, or the hospital, they give them an antibiotic, but that doesn't remove the cause. So these patients put off dental care due to the fear, and then small cavities turn into larger infections, abscesses, and then even in some cases, sepsis. Um, we get chronic pain and tooth loss in the phobics. They often present to our office in a crisis. Obviously, they're afraid to go to work if they lose a front tooth, or if they're totally infected or hurting so badly. The fear of extractions, root canals, or injections is what's held them from coming to the office. Until it gets so badly that they need to come in. So at this point, we can sedate them and do a rehab and get them back to health. There's also that psychological strain that we see in these phobic patients, where the fear reinforces the neglect, creating a cycle of the worsening health, which causes embarrassment, which gives them a diminished quality of life, sometimes a self-esteem when they have decay or breakdown or loss of teeth, which can result in depression and other issues. This can all be resolved by coming in, getting sedated. You won't remember it, and we're able to get you back to health and obviously higher self-esteem and function. What we see with our special needs patients on a daily basis is due to some of the physical limitations, either by the patient or their caregiver or their family. They struggle with oral hygiene. A lot of the special needs patients don't allow anybody in their mouth, or they're combative, or they fight. This leads to plaque accumulation, gum disease, cavities, loss of teeth, obviously. Some of the medical side effects, the medications that some of our special needs patients, two factors. One, a lot of the medications dry out their mouth, which causes more decay, more breakdown. And also some of the medications cause them to grind or clench their teeth, which we see a lot of fractures and a lot of clenching and grinding. These patients, special needs patients, will never wear an appliance, and they will never wear an occlusal guard to protect their teeth. So we need to preserve some teeth, some function in these patients. So if we can get them into the office and preserve some posterior teeth to maintain that function and get them back to health and see them on a regular basis, obviously everybody's happier, the patient, the family, and us, and we don't see those infections. The other issue is some of the feeding challenges. Some of our special needs patients and even some of our dementia patients are on either pureed diets, liquid diets that are high in carbohydrates, causes increased cavity risk, and it's tough to balance their oral hygiene and the decay rate in some of these patients. And the health risks. A lot of our special needs patients have had other medical conditions and surgeries and issues, and untreated infections can lead to life-threatening issues, especially with some of their immune system vulnerabilities or their concurrent medical conditions or some of the medications that they're on. Swallowing all that infection, all that bacteria, especially when they're already compromised, it does not lead to a good ending. So we really want to get these patients in on a regular basis, sedate them, clean them up, and keep everybody happy and functioning. With our dementia patients, as I mentioned earlier, either them being handled at home, in-house by family or caregivers, or being in a facility. Lots of times, once again, either they become combative or resistant to oral hygiene. Memory loss can lead to inconsistent brushing, flossing, which worsens the decay and the gum disease. And then the factors we mentioned earlier of the aspiration pneumonia. That is the biggest concern in our dementia patients and our facility patients, really, is that oral bacteria being aspirated into the lungs is one of the most leading causes of death in advanced dementia, the pneumonia. So we want to keep them healthy. We want to keep them functioning for the rest of their life. And we can do that with sedation. The other issue we see in these patients is malnutrition. Tooth pain, missing teeth, reduced chewing ability leads to poor diet, weight loss. So lots of times they're taking supplements to boost their weight, and those supplements are just filled with pure sugar to gain weight, and that just breaks down their teeth even more. Lots of times the behavioral issues, the combative issues with some of the dementia patients and some of our special needs patients, the aggression or the fear of medical or dental caregivers makes it challenging to get them to the office and to do treatment in a normal situation. So that's where sedation really is the number one factor to getting these patients to have a good quality of life for the rest of their life. The other issue we see in the office on a daily basis is our gaggers. People don't realize it because these are normal patients, but those with gagging issues obviously avoid the dentist. They can't have all that water in their mouth. They can't have people in their mouth. They can't have x-rays taken, impressions, fillings, any of that can't be done in a typical setting. So what happens is obviously they avoid this situation. They avoid the dentist. They avoid those gagging situations, either due out of fear or embarrassment. But then care is avoided or incomplete, and then they get built up and periodontal disease and abscess and problems. And once again, with some of the gaggers, we are concerned with vomiting and aspiration during any procedures. So it really needs to be done in a sedated situation. And, obviously with the gaggers, they're not going to be able to wear any removable appliances. So partials, dentures, most of the time, even occlusal guards, they can't even get it past their lips. They go putting and they're gagging all over the place. So we need to save their teeth. And unfortunately, they don't realize that until there's an issue and they come in. So we're going to look at some of the common end stage medical problems that we see, unfortunately, on a daily and weekly basis. Lots of times by the time the patients get in, we have severe dental infections, abscesses, cellulitis, something called Ludwig's angina, which is life or death. I've had 2 in my dental history. Both of them ended up in intensive care. We saved their life, thank God. But the patient didn't realize how bad it was. Ludwig's angina is an infection that starts building up and cutting off the airway. The first time I saw it, I knew what it was, called a friend, an oral surgeon, said, "I'm having a staff member drive this patient to your office." As soon as the patient arrived, the oral surgeon saw that patient and walked them across the street and admitted them to the hospital. And that patient spent over a week in intensive care and saved their life. The second time I saw Ludwig's angina in my office, the patient was there, said, "Oh, I just need an antibiotic. The infection's getting bigger." And I told my wife I'm coming in and I'll be home. And I said, "No, we're calling your wife and we're calling EMS and you're going right to the hospital." So once again, we saved their life, thank God. And they spent almost 2 weeks in the hospital on IV antibiotics. And actually that patient, my last patient, had to have a tracheotomy because the airway was getting closed. So they had an emergency trach just to open the airway when they got to the hospital. So they are life and death. We do see cellulitis. You do hear about dental infections causing sepsis and patients dying and going to the brain and all this. Those are not rumors. Those do happen. They are rare. But that's, the bacteria building up that's been neglected. So we really do need to get these patients in. Number 2, periodontitis, which is gingivitis and bone loss, leads to tooth loss, which leads to chewing difficulties, in some cases speech impairment if they lose anterior teeth. They can't form their words, which can cause social withdrawal, lack of self-esteem, and then once again, depression, things of that sort. This can all be corrected. Lots of times we can sedate the patient, do a rehab of their mouth in 2 or 3 appointments, and get them back to health and function and get them looking pretty again. So, number 3, chronic inflammation. As we mentioned earlier, the periodontal disease, the bacteria that forms in the mouth, all the gum disease, this is just bacteria that's living that we're swallowing, over 1,000 times a day. This aggravates heart disease, arthritis, autoimmune disorders that are caused by inflammation. That's exactly what all this bacteria is doing, is causing inflammation, and it's just spreading through the system, and that causes, reduced quality of life. Obviously, pain, that's usually what gets patients in, poor nutrition, and then the aesthetic concerns. If they're forming decay or getting loose teeth, or their teeth are spreading, now they're getting all the spaces due to gum disease. Obviously, that's an aesthetic concern, and patients finally come in usually at that point. Why is this so important? Obviously, I hope I've touched the importance of the medical issues that occur from all this. The phobics, obviously, those we can get in, sedate them. It really breaks the fear cycle. Patients don't realize until after they've been sedated once how comfortable, how calm they can be coming to the dental office, when before they're crying, they could barely even come in the chair or sit down. Once they're sedated and they go through the process once, they lose all that fear. They're happy to come in. They know what to expect. They're not going to have any recollection of the appointment. They don't remember anything. They don't have the discomfort. And we're usually able to rehab their mouth in 1, 2, 3 appointments under sedation. And this sometimes breaks the fear cycle, and then they're able to see the hygienist on a regular basis and get their teeth cleaned. Or we see them once or twice a year, sedate them and clean their teeth and take the x-rays and maintain them. So this is totally fixable and important, obviously, to the fear and phobic patients. For special needs, obviously, most offices can't handle the dental treatment, and sedation is required. What we don't realize is with these special needs patients, we need to maintain function and health. And that's what I tell the patients, caregivers, and the parents and the family. If we can maintain function and health for the rest of their life, everybody will do well. Okay. The patient will do well. They'll be able to masticate their food. They'll be able to have good oral health. They're not going to spread that infection, and they'll be able to function. Once they start losing back teeth, everything collapses, and then they break and lose their front teeth. And special needs patients will not wear a denture, will not wear a partial, will not wear occlusal guards, things, any of those removable appliances. So it comes down to whether they actually have enough bone left to get implants and the expense of that, or to get screwed in appliances, which involve implants and surgery again. We can prevent all that by seeing them obviously earlier in the process and trying to maintain their health and function for the rest of their life. With our dementia patients, we're trying to ensure safety and dignity for the rest of their life. Give them some health, keep them healthy, keep them functioning. Obviously it's a strain on the family. It's a strain on their caregivers with a lot of these patients, because it is a downward spiral some of the times. But we can help. We can keep them healthy. We can keep the bacteria. We can keep the pneumonia away and give them that dignity that they deserve. With the gaggers, we can suppress the reflex, obviously, while they're sedated. This allows us to get the x-rays. It allows us to do the treatment. And like I mentioned earlier, patients show up every day, every week, and say, okay, I'm ready for dentures. And I'm like, I can't even put a mirror in your mouth. You're never going to wear a denture. You can't get past the lips, and you're spitting everything out. We're never going to get an impression. These patients don't realize that gaggers are not going to wear a denture on their palate where it tickles. No, it's just not going to happen. So we either have to save their teeth, or we have to place replacement teeth that are screwed in with implants and try to maintain some function with these patients. So we do want to see them early when they are a gagger, and try to, maintain that and change their education on the dental health and avoiding the dentist. If we can see them, obviously we can turn that around and keep them healthy, and we don't have to worry about losing teeth or ever having to think about a denture or replacement at all. So, I've just listed some of the patients, obviously, that we see and the major concerns. Obviously, there's other medical issues that are formed from all the bacterial infection that does come through the mouth. As I mentioned earlier, the oral cavity is the dirtiest orifice of the body. There's more bacteria in the mouth than anywhere else on the body, and that multiplies if it's not being cleaned out, and we're swallowing it all day, every day. So it does cause major issues from a dental point of view and from a medical point of view. So come on in. We can get you to a better oral health and lifestyle with Sedation Dentistry. Obviously, we're here to help. If we can be of help to you, we can be reached at happydentistry.com or 813-DENTIST. As always, thanks again for joining me. And until next time, keep smiling.